to Spotlight on Diabetes Education. My name is Barbara Eichorst, and I'm here today with Dr. Tony Vesco, who's a psychologist, and we are here to talk about dealing with emotions and feelings and living with diabetes. So, Dr. Tony, how do feelings impact diabetes self-care?
Well, first, Barbara, thank you for having me today. It's a pleasure to be here and, kind of helping out with ADA, of course. And to your question, how do feelings and emotions impact diabetes? I think feelings, especially more difficult or unhelpful or unpleasant feelings, can definitely impact diabetes management. We know that diabetes can create quite an emotional burden on people living with diabetes. There's kind of constantly running emotions and thoughts associated with living with diabetes that are always present, even in the face of every other day life stressors. So feelings such as anger, sadness, guilt can all be present at any point. They can kind of just come up for people with diabetes living with it as they're dealing with other stresses in their lives too. We can also think about the way feelings might impact the way we connect with other people too. So family and friends, we might feel like we can't trust other people or others not trusting us. Whenever we're trying to manage our diabetes. We can also, because of diabetes, feel more isolated or disconnected from others, from others who may not understand what living with diabetes looks like or what it feels like for us. And then there's also just the regimen-specific distress we might face, not feeling like you're keeping up with diabetes well, or feeling like you're failing with diabetes, or worrying about future complications related to diabetes. So these are various ways that diabetes can create stress and anxiety and fear in our lives. But what I want to say today is that all of these feelings are normal and they're actually harmless. The feelings themselves can't hurt us. It's more about the choices that we make from these feelings. And so the question is, how can we ride out the wave of these feelings until we feel all right?
Sure. Can we believe those feelings when they're true, or can we take those feelings, the negative feelings, and transform them into the positive feelings?
Yeah, I think all feelings give us information and they allow us to understand and interpret our worlds. So even things like anger or feeling sad, right? That's all part of being human. And I think if we're feeling angry about diabetes, there's usually a reason behind it. Whether it's because we feel like people aren't understanding us, or we might feel that we're not doing something well with diabetes. And then it offers an opportunity for us to problem solve in those moments. So for example, if we're feeling frustrated and kind of isolated because of diabetes, maybe that's an opportunity to reach out and connect with somebody or connect with a group of people that might be living with diabetes, or a healthcare professional, for example.
I love what you just said, that having those feelings offers us an opportunity to problem solve. So we can capitalize on those feelings and do something good about that. So that makes a huge difference. How about those negative feelings? How do we deal with them when we get them? How do we process them?
Yeah, I think the first major thing is reminding yourself that diabetes is a part of your life, but it's not the sum of who you are, right? So just because you're having these feelings, a lot of people with diabetes feel the same way that you do. We don't want diabetes to kind of be the story of our lives, right? We want it to kind of be a story in our life. And so I think one step to kind of dealing with unpleasant or more negative feelings is to first validate yourself. Allowing yourself to be annoyed by diabetes, allowing yourself to have the thought that diabetes is unfair, and also telling yourself too that I am more than my diabetes. I think that's an important very first step, is acknowledging that you're feeling this way, kind of owning those feelings and recognizing that it's all right, because there's a whole community of people that are feeling the same way that you do. I think another way to deal with the negative feelings is to kind of set small achievable goals to develop a sense of mastery. So if you are feeling some type of way about diabetes, maybe you try just a little, something small today to kind of help manage your diabetes. Or if you're feeling disconnected from others, maybe one small step to kind of reconnect with somebody or form a new connection. The goal is to try our best to kind of cope ahead of time and try to integrate diabetes before it becomes a huge stressor for us. So if we can kind of tackle every small problem related to diabetes along the way, it's more likely that we're not going to feel burned out by diabetes or let the feelings kind of overtake us. I think another thing too, in addition to, owning the feelings and validating yourself, it's also trying to build connection with other people. So this can be done through ADA or other local support groups or agencies. We really need to find our tribe and our community who can help support us through the literal ups and downs of diabetes. So kind of asking yourself, who can help you to hold some of the burden of diabetes? Who are supports that can just listen to you? Who are your supports who can assist you with diabetes management tasks as needed too? and then being sure to kind of tell other people what you need specifically. If you need a person just to listen to you, just to vent, let them know that's what you want them there for. If you really need someone to help you with management tasks or kind of take some of the burden off of you, saying that to them outright, I think is really important. So the best that we can to remove health-related stigma associated with diabetes, the better, because we know that stigma is related to more depressive symptoms, more anxiety, higher A1Cs, and it can also lead to complications down the line in terms of diabetes scores.
Yeah, we hear a lot about diabetes and stigma. So how is it connected with feelings?
Yeah, I think a lot of times our feelings and the thoughts that we have are often the messages that we bring to ourselves, right? And so stigma results from both our interpretations of the world and our like internalized negative beliefs about being a person with diabetes and the things that we may not be able to do or we think we can't do because we have diabetes. And it's also coming from like the myths that are kind of perpetuated throughout society about what it means to be a person with diabetes that then becomes almost internalized by people living with diabetes at times. So I think stigma can be self-perpetuating and internalized. It can kind of come from within. But I think it's also the messages you might have gotten from family, from the broader community, from the healthcare community about what it means to live with diabetes, when sometimes those messages aren't entirely true.
Sure. So what can we do to not own those untrue messages?
Yeah, I think it's really important first to kind of acknowledge the thoughts that you're having and slowing down, labeling your feeling, labeling the thoughts, kind of putting words to it. Sometimes people might do that through journaling. Sometimes it's a matter of just writing your thoughts out like on a Post-it, right? Whenever you're kind of feeling in your thoughts and feelings and you're feeling some type of way. So I think the first thing is, again, owning it, kind of recognizing what it is, and then working hard to kind of look up the facts. Like, is this thought actually true, right? Like, what is the evidence that I have to support it? What is the evidence that I have to refute this thought? If I were to tell this to someone who like loves me and cares desperately about me, right? What would they say back to me? Or what would my best friends say back to me? And kind of taking a different perspective on the issue as a way to challenge those negative thoughts and kind of challenge those stigma-related beliefs.
It makes sense because we don't always want to believe our own thoughts because they might not be true. And then kind of process it and then kind of rationalize it and realize that our thoughts are not always who we are. So tell us more about who can we ask for help? Because oftentimes we don't want to burden our friends because we don't want them to kind of think of us as a drama people that we always bring problems to them, emotions. The same thing with the healthcare professionals. Oftentimes we want to focus on diabetes management when we talk to them, not necessarily about all of the things that are going on in our head. Who do we ask for help when we need it?
Yeah, I think friends and your close partners can be a good source of initial support, but sometimes they may not fully understand, right? And I think when we're feeling overwhelmed by our diabetes, to the point where we're so distracted by diabetes that we feel like we're missing out on our typical life pleasures or joys, or if we find ourselves engaging in more self-sabotage because we're so kind of messed up or in our heads about diabetes that maybe we turn to drinking or drugs as a means of coping, right? And it's a way to kind of feel good in the moment, but it kind of takes us out of our lives. Those are times when we should probably speak first with either our primary care physician or endocrinologist. I think those are the people that we have the most contact with a lot of times living with diabetes. And a lot of times in those same clinics, there's either a clinical social worker or a clinical psychologist who might be a part of those clinics who can do a screening with us to kind of determine where our diabetes-related distress is relative to other people, where our anxiety and depression is related to other people, and can usually make helpful suggestions in the short term as well as in the long term of how we can help manage our large feelings related to diabetes. I want to just say a lot of times people have a kind of a thought about therapy or a thought about mental health providers as, kind of you go in, you sit on this couch and you have to talk about your feelings for like years and years on end. But a lot of treatments for depression, anxiety, and for diabetes related distress are time limited and they're short, right? And they're actually pretty effective as well in kind of helping people with diabetes feel less distressed. And also a lot of the research work has been shown that these behavioral interventions can also help with managing tasks daily in a way that seems more efficient for people with diabetes. So I want to kind of remove that stigma that seeking help is a bad thing, because I think, one, people out there, that's their job. They're there to kind of help support people living with diabetes in these roles. And two, it's also time limited, so it won't be a huge time suck as like what most people kind of think of when they think of going to therapy.
Makes sense. So the final question to summarize it all, tell us what can a healthcare professional such as myself do to help people with diabetes deal with those feelings?
Yeah. I think similar to what we discussed earlier about the internalized stigma that people face because of living with diabetes and kind of like their own self-talk that can become negative or unpleasant. As medical providers, we have to be very aware of the language that we use, because we know that language can affect trust and perceptions of criticism, and perceptions of lack of engagement in diabetes care can be unmotivating for people with diabetes, and it can lead then to worse diabetes-related outcomes, and then it can lead to even more stigmatized language coming from medical providers. So it's a vicious cycle that we can get into. So we want to kind of like just check our language. So if we're finding ourselves saying things like about our patients that we're saying they're unmotivated or they're lazy or they need to try harder, like we need to kind of rethink more about like what the barriers are that they're perceiving, and try to make our best efforts to collaboratively engage with people with diabetes, our patients with diabetes, and help them to problem solve those barriers versus just kind of labeling them as unmotivated or lazy. I think also we want to make sure that diabetes doesn't come off as evaluative in any way. So there's a common phrase that's like, we have to test our blood sugars. Why is it a test? Like, is it pass fail? I don't understand. So even changing like small words like that to blood sugar checks, right, are good things. Making sure we're not leading an appointment with discussions of A1C or even glycemic variability, and more asking like what's going well with diabetes versus like what's starting with the conversation with like what's going wrong with it or what's the problem. Because a lot of times I think people with diabetes interpret that as like, what's the problem with me when that question is being asked. So we want to be strengths-based. We want to ask what is working. If something's going really well with diabetes management, how can we extend this skill and set even more goals that kind of build off of that initial strength of the person? And I think another big thing, and it may sound kind of hokey or kitschy, is to kind of use more we versus you language, right? So we want people, our patients with diabetes or the people that we work with, to know that we're a team here, that we want to work with them and kind of helping them to manage their diabetes. And so even using the words we versus like what you should be doing, or you should be doing this, or your family should be doing this, it should be like, what can we do to kind of help solve this problem together? And I think lastly, just thinking about like what's important to the patient in this visit and like what their values are, and how can we kind of build our goals to align with their goals, right? So if they're saying, you know, I really want to feel less worried when I go out to dinner because I'm so worried about my diabetes, my blood sugar is kind of going up and down too much, maybe we focus in on figuring out like what places they would like to go, and kind of like looking at the menu together and figuring out how we can count carbohydrates and kind of think about the insulin that needs to be on board prior and during that meal. So I think those are some things that providers can do. So removing stigmatizing language, being strengths-based, using that we language, and also focusing the visits on the patient's goals and values, not just your own.
Makes sense. 3 takeaways for people to keep in mind. Number 1 would be that feelings are normal and expected. The second one is we can convert those feelings into what we can do with them. And the third one would be to talk to your healthcare professionals about how you feel with diabetes. So thank you so much, Dr. Tony, to talk to us today. And thank you, everybody, for joining and listening. Have a good day.